All right, Dr. Nguyen here. I want to talk to you about crown margin integrity and why getting an adequate seal on a crown is so important to us in dentistry. Here on the front side of the crown, the seal between the interface of the tooth and the crown is adequate. Now, no bacteria can enter from that site. However, on the back side here, if you notice the gray hue that's highlighted, that seal has been compromised. And when a seal is compromised like that, bacteria and saliva is introduced underneath the crown. And then if bacteria is introduced underneath the crown, a big cavity can start to form, which is what happened in this case. Now, in this next x-ray, you can't tell because of the angle. You also can't tell that there's a cavity on that big tooth in the back highlighted here. That's why a clinical exam is very important, okay? The clinical exam will reveal to us right here with the photo that a cavity is happening underneath the gums. So the patient's in pain for both of these teeth after testing has been done. Patient elects extraction and a denture to be made. So here, the crown is very loose already because that seal has been broken over time. Now, after we remove the crown off, from what you can see here, the cavity is very, very large at this point. And once this crown is off, we can point that out right here. Okay, that black area is very decayed tooth material. So whenever we do crowns on anyone, we want to make sure that seal is adequate. So if we ever do need to remake a crown for you, it's most likely because the seal was not adequate. Okay? All right, and this tooth is about to be out very soon. Here we go. Now the tooth is out. And there's the cavity right there, that brown area noted here in the photo as well. Okay, so this tooth, we ended up cutting it in half so we can act like they're singular teeth to help with the extraction. So if you do need teeth extracted, we may cut it in half just to make the extraction much easier for you. Okay? And then after this section is out, we will place some sutures and have you back in about a week. Okay? The reason why we want you back in a week is because we need to make sure that the site is healing well and that there's no infection occurring. And if there is an infection occurring, then we need to take the correct steps to help resolve that infection, whether it be to prescribe antibiotics or take further steps. Now here is the patient back after 1 week, and here is the wound healing site. And we've already removed one of the sutures, as you can see here. And we remove the other suture, and it looks like the soft tissue healing has been going very well. We have full soft tissue closure for both sites, and we just have a minor socket left on one of the teeth, of which we will then teach you how to irrigate that socket with this plastic syringe very gently to make sure no food gets impacted into that socket. Okay? All right. Thank you for watching and take care.